Hi there, my name is Laura. I am a nurse specialist in the Ambulatory Gynecology Clinic, or AG Clinic for short. You're probably wondering what an AG Clinic is and why you've been referred to one. In this video, we will explain what the clinic is and what you can expect during your visit. What is an AG Clinic? An AG Clinic provides treatment to patients who don't need to stay overnight in hospital. Our aim is to assess and treat your gynecology issues in as few visits as possible, sometimes in a single visit. This means that, in addition to having a consultation with a doctor or nurse, you might also be able to have a procedure on the same day. For example, an ultrasound scan, a hysteroscopy, or biopsy. These procedures will be explained later in the video. In this way, most people can avoid having a general anaesthetic and can use over-the-counter pain relief to manage any discomfort. So, why have you been referred here? There are many reasons why someone would be referred to an AG clinic. It may be because you've had some sort of abnormal bleeding, such as heavy periods, bleeding in between periods, bleeding while on hormone replacement therapy, or post-menopausal bleeding. Many women who are referred to us have endometrial polyps or fibroids that require investigation or management. Sometimes you may be referred because you need a contraceptive coil inserted or removed. Your doctor also may have referred you as part of fertility or miscarriage investigations. If you're not sure why you have been referred, you can discuss the reason for your referral with us. What should you expect when you visit the AG clinic? On the day of your appointment, you don't need to be fasting. We may recommend taking some over-the-counter pain relief about an hour or two before coming in. Hospitals and clinics can be very busy, so please allow at least an hour for your visit. If you like, you can bring someone with you, but it's not necessary. You won't, for example, have any treatment or procedure that'll prevent you from driving. When you check in at reception, you may be given forms to complete. Please ask if you need any help with this. You will then meet one of the AG team. This could be a doctor or a nurse specialist. They will take your medical history and go through the reason for your referral. If you are on any medications, it may be helpful to have a list of your medicines with you. The entire process will be explained in detail, including any procedures that may be recommended. You will be asked to sign a consent form, and this is an opportunity for you to ask any questions you may have. If you have not taken pain relief before you visit, you may be offered pain relief at this stage. Everyone's experience of pain is different and will depend on the particular investigations and procedures needed. Most women find procedures in the AG clinic acceptable. However, some women may find the pain severe and may feel faint. If this is your experience, any procedure can be stopped at any time. You are in control. Some people may need a procedure under general anaesthetic on another day. Together with your healthcare team, you will discuss the best approach to your care. What happens next? In the procedure room, you will then be asked to undress from the waist down and lie on a bed with a sheet to cover you. We'll make sure you are as comfortable as possible. A nurse or healthcare assistant will be with you for support. If you have not had an ultrasound scan before your visit, we may need to do one on the day. During the ultrasound, a probe will be gently inserted into the vagina to take images and measurements of your womb. Some may experience some light pressure during this. Most women do not find this painful. We will explain the ultrasound findings. We may recommend that you have a hysteroscopy. If you are happy to proceed, this procedure can follow on from the scan on the same day. What is a hysteroscopy? This is a procedure to examine the inside of your womb. This is done by passing a small, thin camera through the cervix, the neck of the womb. Fluid is used to open up the womb to allow us to examine it fully. This hysteroscopy allows your healthcare provider to see if there are any problems inside your womb that may need further investigation or treatment. The procedure will take about 5 minutes. The majority of women report pain similar to that experienced during their period. Sometimes local anaesthetic given just before the hysteroscopy can help. However, some women may find the pain severe and may feel faint. Remember, we can stop the procedure at any stage if you are finding it too uncomfortable. What are the benefits of a hysteroscopy? Well, there are many benefits to this approach. There is no prolonged hospital stay. The entire appointment usually takes about an hour, and then you can leave the hospital and go about your day. You don't need to be accompanied to your visit. You avoid the risks associated with the general anaesthetic. What else may be involved? At this point, there are a number of possibilities depending on the findings of the hysteroscopy. These are all explained in the next video. Are there any risks involved with a hysteroscopy? The risks associated with an outpatient hysteroscopy are very low. A rare complication would include injury to the womb. Although there is a very low risk of infection, you should watch out for the following signs after your visit: high temperature, unusual discharge from your vagina, tummy pain that gets worse. Please seek medical advice if you are worried you may have an infection. You will usually experience some light bleeding or spotting after the procedure. We will provide you with sanitary pads on the day. What happens next? Most women feel well enough to go home immediately after their appointment. Some even go back to work. Others may take a little longer to recover. You may experience some period-like cramping or discomfort immediately after or for a day or two after your AG appointment. You can manage this with over-the-counter pain medication as recommended by your healthcare team. The results of any tests will be posted to you, or you may receive a phone call. A letter will be sent to your referring doctor. Some patients may be asked back for follow-up. We hope you found this video helpful. If you have any questions or want more information, please contact your local AG clinic. Thanks for watching.